The member for Canning has the call.
Thank you, Deputy Speaker. I have risen many times in this place to discuss matters of importance to the electorate of Canning. While today is no different, what I wish to speak about cannot be summarised in a word or a sentence. It's very complex. It affects different people in different ways. For some, it's drug and alcohol addiction. For others, it's domestic violence. Sadly, for too many, it's mental health issues and suicide. When I was first elected to this parliament in 2015, Canning was crying out for assistance to help stem the flow of ice into the community. I spoke to school principals who were trying to manage drug-addicted children, parents who were scared of their violent kids, service providers who had more patience than resources to help them, and small business owners who were fighting an uphill battle against crime. The overwhelming message was, something needs to be done. Within 30 days of being elected, I established the Canning Ice Action Group, made up of educators and service providers I'd spoken to, in addition to local government, community leaders and police. After a number of meetings and a public forum, it was identified that while ice is indeed a big problem in Western Australia and in Canning, it is symptomatic of broader social dysfunction. On Monday, the Australian Criminal Intelligence Committee released its first national wastewater drug monitoring report, and the results are alarming, Deputy Speaker. In Perth, the daily consumption average of ice is 1 dose per 17 people. Nationally, it's 1 dose per 28 people. As the Minister for Justice stated this week, quote, "We cannot simply arrest our way out of this problem," end quote. The only way we can tackle this problem is with long-term behavioural change, preventative methods. In order for the ICE Action Group to effect that change, it was agreed we needed to shift our focus from rehabilitation to prevention and early intervention, targeted at but not limited to drug and alcohol addiction, mental health and youth suicide. We recognised that there was no point reinventing the wheel by duplicating services that already exist. GP Down South, a wonderful local organisation which runs the Peel Youth Medical Service, known as PIMS, was already operating at capacity, providing outreach and in-house services to 400 young people a month in the Peel region. Eleanor Britton from GP Down South has a plan to cater for this growing demand with the PIMS Health Hub, a plan supported by the Canning Ice Action Group targeting 12 to 24-year-olds in the Peel region. The project will co-locate PIMS alongside other providers in the Health Hub to ensure clients and their families have access to a full suite of services, including GPs, a psychologist, a mental health social worker, and an eating disorder clinic. Tragically, the need for better models of preventative care is evidenced by a number of youth suicides in the Peel region over the last 2 years. This is very sad, heartbreaking development in our community. Acknowledging the gravity of this situation very early on in April of last year, the Prime Minister and former Health Minister met with a delegation from Peel comprised of local and state government leaders from both sides of politics, police, students and youth leaders. We impressed upon them our community's need to get the PIMS Health Hub off the ground. Gratefully, I'm very grateful that we managed to secure $2 million for capital works from the PIMS Health Hub at the federal election. The Prime Minister has followed this project very closely and is invested in it. At the recent state election, this project received bipartisan support, with both Labor and Liberal committing to fund the remaining $5 million. And I commend local MLAs, David Templeman of Mandurah from the Labor Party and Zach Kirkup of Dawesville, newly elected of the Liberal Party, for their advocacy for PIMS. As devastating as these deaths have been for our community, it has drawn people together to look for a solution that is lasting. Part of that solution is a Headspace, a National Youth Mental Health Foundation's facility that focuses on early intervention for youth needing help with mental health, physical health, work and study support, and alcohol and other drug services. At present, there is no Headspace in Canning, and the closest one is over an hour away by public transport. Acknowledging a gap in the services, and in response to this government's commitment to fund 10 additional Headspace centres, PIMS has started a petition to get a Headspace in the PIMS Health Hub. So we'll get the funding for a new facility, we'll have a range of service providers which complement the PIMS vision, and we're very hoping that the Federal Minister for Health will commit to putting a headspace in the PIMS facility. Now, PIMS has been working very hard, and to date they have just over 2,300 petitions from the local community. And just 2 weeks ago, I stood at Halls Head Shopping Centre with the PIMS team to promote their petition. In an hour, I heard many stories of loved ones lost to suicide, youth struggling with depression, and parents who didn't know how to help. I really noticed the interest and concern that many people expressed about the problem that we have in the Peel region. People who were just there to shop, and they took their time to step aside for 5 minutes and talk with the PIMS team. So it was heartening for all. It just reinforced how many people in our community need better services. Since then, I've had a very positive conversation with the Minister for Health about the petition, and I'm hopeful Mandurah will soon be announced as one of the new Headspace sites. This would be a considerable encouragement for the Peel region. But Deputy Speaker, no amount of health hubs or headspaces can come close to achieving what the Canning community already has on its own. We have service providers united by a focus on preventative care. We have bipartisan support at all levels of government, local, state and federal. We have a football and a netball club encouraging its young members to talk openly about mental health, and we have community support to address youth suicide. As I said, we have very, very strong grassroots support. In fact, last year I went to a fundraiser put on by local community leaders for PIMS, and I think in one night they raised something like $50,000. So this is an institution that is fully functional and has a lot of support before the state or federal government comes to the party. So the vision is to supercharge PIMS and make sure that they optimise their service for the community. Now, all the changes that I've spoken may be incremental, but they're not insignificant. These things take time. Institutions take time to build, Deputy Speaker, and healing with this problem also takes a long time to heal. But I'm proud of the people of Canning for the support they've given me. I'm proud of the things they've done as individuals and the way they've come together as a community to get our young people back on track, and I'm hopeful that we can turn this drug and alcohol problem and suicide problem around, and we'll have a strong community into the future. Thank you.
Thank the member for Canning.